Good morning, everyone. It's great that you can join us this morning. My name is Amanda Wendt. I'm joining from Earth University in Costa Rica, and I will be the moderator today. We have two wonderful panelists that will talk to us about Juntos por la Salud, and I'll just tell you a little bit about each presenter. Alejandro Porrey is the Dean of the School of Social Sciences and Government at Tecnológico de Monterrey. And since 2016, Alejandro has served as the Dean of the School of Sciences and Government at Tecnológico, where he also served as Dean of the School of Government and Public Transformation. He has a PhD degree in political science from Harvard University. He has lectured at universities in Mexico, the United States, Europe, and Latin America, and published articles and books on topics related to democracy and prosperity. In the public service sector, he held different positions, including Secretary of the Interior, Secretary of the National Security Council, and spokesman of the security strategy during President Calderón's administration. And today he'll talk to us more about what is Juntos por la Salud. Then we have Inés Sáenz. She's the VP of Inclusion, Social Impact, and Sustainability, also at Tecnológico de Monterrey, and she'll tell us more about how the initiative connects to Sustainable Development Goals. Inés is the VP of Inclusion, Social Impact, and Sustainability at Tecnológico in Monterrey. She was former Dean of the School of Humanities and Education in the same institution. As Dean, she had overall responsibility for the schools and academic undergraduate and graduate programs and research projects. She has worked at Tecnológico de Monterrey for 25 years. As part of the Office of the Provost, she developed the main curricular area of humanities and citizenship and was director of the PhD program in humanistic studies. She earned an Master's of Arts and a PhD in Hispanic literature from the University of Pennsylvania. So I just want to go ahead and mention to all of our participants, attendees today, that we would love to have questions from you, and there's the Q&A function where you can write those questions. And then after the presentations, we'll go through a session and try to get to as many of the questions as possible. We also encourage you to go ahead and use the chat function to communicate with each other or make any notes or suggestions in that chat function. So without further ado, I'll go ahead and shut off my microphone and camera and turn it over to our first panelist, Alejandro. Thank you.
Thank you very much, Amanda. It's a pleasure for us from Tecnológico de Monterrey to be here this morning. We want to share with you a presentation about what Tecnológico de Monterrey, alongside many allies from society nationwide in Mexico, have done to address the COVID-19, at least some of the challenges that the COVID-19 pandemic and crisis has brought upon us. Basically, the first slide of the presentation shows you a little bit of what the challenge of the COVID-19 crisis has brought to our country. As you know, we're one of the countries with the largest number of per capita deaths, and we have a very significant challenge, a very uneven health system. On the right, we have a chart of the different mortality rates in our health system. The first column indicates the mortality rate of people incoming to hospitals in our nationwide social security system. And at the furthest right, we have the mortality rates of people incoming into the private private health sector. And even within the private sector, there is a very uneven distribution of quality in access to health in Mexico. So it was very obvious from the very beginning that we needed to make sure that we had instances to address and to try to support the health system, in particular in the public sector. Mexico is also has been recently identified as one of the countries where most health workers have died. So the purpose of Juntos por la Salud was to, in the next slide, please, was to have a way of addressing the COVID-19 health, economic, and social crisis, not just through communication, but also to try to create a distribution network to try to help this uneven and, in particular, not well-prepared public health system in our country to try to mitigate the impact of the crisis. In the next slide, you'll see that this is a nationwide effort that encompasses not just Tecnológico de Monterrey, but also the National University, UNAM, the Mexican government through its Ministry of Foreign Affairs, which has coordinated a big part of the response, and also partners in the private sector, very notably BBVA and Salud and Fundación FEMSA as well. Juntos por la Salud, the literal translation is United for Health, but it's more about an initiative where we cherish our health, to try to do something together to improve the situation in Mexico. It's a joint initiative to try to bring together these efforts, in particular at the local level and with a particular focus in public sector hospitals that have been identified as quote-unquote COVID specialized hospitals by the Mexican government. And basically what this entailed was, in the next slide, to create an organizational network to make sure that in each and every state of Mexico, as you know, Tecnológico de Monterrey is a nationwide university. We have 27 locations in the country. And to try to use that structure alongside the structure of our advisors that are local business people nationwide and other leaders in civil society in all of the regions of Mexico, to create this local committees of BBVA, business people, and also our advisors nationwide, which would create this network that would bring efforts and donations to these public hospitals, in particular for PPE, protective equipment for people at the front lines of the pandemic, but also to bring training of healthcare professionals, and in particular, as the pandemic evolved, to develop knowledge-based networks to help the business and social community nationwide to address not just the mitigation efforts at the beginning, but also as the pressure to start reopening built up, to have the adequate measures and the adequate protocols and the adequate communication strategies to make sure that this is as productive and as safe as possible. This has served as a platform of dissemination of information, but also in particular of delivery of certain goods and services for the people that are out there still working very hard to protect the health of our Mexican population and our in all of the countries. So in the next slide, we have a sense of just what the results of this particular effort has been. We have delivered protective equipment kits to 130 hospitals in 32 states. I mean, you can see the number there is millions of gloves, of coats, and of caps, of goggles, of masks and face masks, and all sorts of types of equipment nationwide. This is an ongoing effort. This has all been procured with private funding, like I said, from business people and civil society nationwide, and this is an ongoing effort. It is sad to say that the outcomes of the health pandemic in Mexico are really very low or very bad compared to other countries, but we believe that this is an effort that has actually been helpful in terms of mitigating some of the impact and trying to help, in particular, like I said, public sector hospitals be better prepared for the pandemic and the impact that it has on its health workers. Some of the additional results of, in the next slide, there it is. These are the over 500,000 medical kits in 130 hospitals, but we have also trained over 10,000 healthcare professionals. As you know, Tecnológico de Monterrey has its own hospitals and its own medical school, and through the expertise, we have also been able to aid and help local authorities to improve the capacities for responding to the crisis. We have also created database state workshops for the economic reopening strategy, and we have had over 70 public, private, and academic institutions nationwide participating in this very large effort, like I said, with local coordination committees that have worked hand by hand with the government to try to improve the situation. in every single one of the states in Mexico. The next slide, please. So, like I said, this is a very important and significant effort, and it's a significant effort that it's a part of a more general strategy by Tecnológico de Monterrey to address sustainable development goals. And I'm very happy to pass the microphone on to Inés Sáenz, who will talk a little bit more about that.
Thank you, Alejandro. Well, Alejandro has explained the overall project, its objectives and main results that aim to tackle and mitigate this crisis. In this section, in the following section, I'm going to discuss these results under the SDGs perspective. The 4 SDGs where this initiative has a stronger impact are, as expected, SDG number 3, good health and well-being. There's also a significant impact on SDG 8, decent work and economic growth. SDG 16, peace, justice, and strong institutions, and partnership for the goals, which falls into SDG 17. So let's go, Alejandra, to SDG 3. With respect to SDG 3, Juntos por la Salud has coordinated a number of projects and actions addressing the good health and well-being of Mexicans. Over 78 million US dollars have been invested to provide medical equipment, expand availability of personal protective equipment kits, and train more than 10,000 healthcare professionals. This joint effort covers 130 COVID-designated hospitals throughout the country. Additionally, JPS, Juntos por la Salud, is ready to promote and support research in order to enhance the country's development of tests, treatment, and vaccines for COVID-19. So let's go to SDG 8. As for SDG 8, that stands for decent work and economic growth, we've made a big effort to boost economic recovery by coordinating donation efforts and prioritizing activities. In particular, we've organized, and we still are organizing as we speak, scenario construction workshops to identify the most viable economic reopening strategy for each state. We've also delivered more than 20 knowledge sharing workshops with key stakeholders in different parts of the country. And additionally, we've put in place a robust public-private multi-sector governance structure with specific emergency response goals. Let's go to SDG 16. Let me see if I see SDG 16. Okay. As you know, there are trade-offs between reopening economic activity and supporting public health. Consequently, we've worked together with local institutions to develop a reopening strategy based on detailed information and data. By providing this information and data to local institutions, it is possible for them to make better decisions in setting the path to develop an effective and peaceful recovery. And last but as important as the previous actions impacting SDGs, Juntos por la Salud has had a significant impact on SDG 17. The creation of partnerships between public and private sectors has been a successful effort. This network has enabled coordinated and efficient responses to better address health and economic recovery challenges. The National Coordinating Council has put together 70 institutions, including private enterprises, public sectors, NGO, and foundations, to work to collaborate with each other. So we can say that Juntos por la Salud is a young but strong partnership that will continue to operate throughout this crisis, providing beneficial results for the present moment and the future. We invite you to take a look at our website at www.juntosporlasalud.mx. We're now open to questions, and back to Amanda Wendt.
Thank you so much for your presentation, explaining this quite impressive initiative, a public-private initiative. We don't have any questions yet in the question box, so I'm encouraging everyone who's participating to go ahead and send in your questions. We'll have some time to go over your questions for sure. But I was wondering if you could explain a little bit how this all got started and in place so very quickly, with the whole pandemic just basically happening overnight, it seemed, to get such a large initiative and so many donations already mobilized is quite amazing. So maybe you could explain a little bit how you got all these stakeholders to the table, or what was the mechanism also that Tecnológico played to really catalyze this kind of initiative?
If I may answer this.
Mm-hmm.
Yeah, thank you, Ines. There's a couple of things that are useful to understand how this we were able to put this together. One of them is that Tecnológico Monterrey, like I said, we have our own hospitals in Monterrey, and we also have our a medical school in Monterrey and Guadalajara and in Mexico City, Mexico's 3 largest cities. And we have a very tightly knit connection to civil society in every single location in which we are based. We have local advisory boards of civil society leaders and members of the business community. And in particular, Tecnológico de Monterrey was very quick at the beginning of the pandemic to make the decision to go fully online in our instruction courses and to adapt very rapidly to make sure that everyone could continue having their educational experience through online means as quickly as possible. So with these two elements as a context, Tec de Monterrey was also able to very rapidly address the need from members of the local government in Nuevo León to help them with their response to the pandemic, and through FEMSA and BBVA, these 2 large institutions as well, which we are closely linked to as well, to address the situation alongside Mexico's federal government, and to think of ways in which all of these capacities of the advisory boards of Tecnológico de Monterrey, of Tecnológico de Monterrey's medical school, of BBVA's advisory boards and at the regional level as well, and through the leadership of José Antonio Fernández, who is the president of FEMSA, we were able to build it up together and to come up with a response. That is, I think the critical issue there is not just all of these context elements of context, but the linkage between the Tec de Monterrey's medical school and Tec de Monterrey's School of Government and Public Transformation. We were able to create a number of knowledge-based initiatives that also aided this effort. So I mean, it was I think it's a once-in-a-lifetime challenge that was presented to our society, and we have been happy to do a little bit of a little part of it and responding to it through all of these means.
Well, I'd like to add something that complements what Alejandro has just said, that one lesson learned with this crisis is the power of collaboration, the power of organizing our academia, the School of Medicine, the academia and the School of Public Government and Social Transformation, the School of Engineering, etc., our entrepreneurs, our board, civil society, etc., and the public sector, business communities. This is a big lesson that we have to keep in mind for the future. And that's the message I would like to express, that we together we do a lot more than just going forward as individuals or as a one institution.
I think that that's a really good point about collaboration. Actually, it brings us to one of the questions that we have in the question box from Emilio Martinez. Curious about what the biggest challenge has been to align all of the stakeholders' views and interests in responding to COVID-19 as a united front. As you mentioned, collaboration is the key to all of this, but we're curious about what these challenges have been to align all of these views to have this effective collaboration.
Well,
Adelante, Inés.
Okay, well, first, to build up a common ground. I mean, we all live together. We can talk about public sector, private enterprises, but anyway, we are all affected by this pandemic. So we knew the trade-offs between reopening economic activity and supporting public health. What can we do to tackle this crisis, to mitigate it? So I think this university, particularly Tec de Monterrey, we have experience in alliances, partnerships, and we know they are effective. And that if we set a goal that will benefit us all, it's easier. I mean, to overcome the challenges. Of course, there are challenges. We set up a platform, digital platform, so that we to put together all these initiatives. And I think that was a very good start. And well, Alejandro can talk more about it. This good platform of Juntos por la Salud, and I think that sharing information is key to go forward and overcome our crisis.
Yes, I think that's the idea of a common ground that Inés has expressed. I think is critical. As you know, I mean, societies and governments worldwide have had disputes about what's the best way to go about in addressing the COVID pandemic, and Mexico has not been absent from those. But I think the critical issue here was that the way to build this common ground is through this stakeholder initiative, but also to say, look, this is what we can do. This is what science tells us that we should do, and this is what we can do together. And I think the critical part was to make sure that the few things where we would have certainty that we would have a clear impact, we focused on those. And so the first one was, okay, how can we make sure that we have protective equipment delivered to as many people as possible, as quickly as possible, in addition to whatever efforts the government can do to provide and procure for those people. And I think that was one of the key things that allowed us to bring this initiative forward. The second part, just like Inés said, okay, what are the trade-offs between reopening and not reopening? And if we're going to do it, how is it that we should do it? Okay, can we implement a testing strategy for businesses that are actually going to have to reopen relatively quickly? How can we actually improve our methods of tracing for cases that have been identified? And a number of these initiatives are based, I think, in our university, particularly because we are the institution where we can bring together all of our schools, the humanities and education school, the engineering school, the business school, the architecture and design school, every single one of the schools, and to give knowledge that will be pertinent to these decisions that have to be made both by local authorities and federal authorities, and also leaders of civil society and business.
Excellent. I just want to encourage everyone who's in attendance to go ahead and send in any additional questions that you might have. I have another question myself about, it seems that there was already a lot of structure in place with this network of hospitals and connections to local communities and initiatives. What would you recommend to other places, other communities or other systems that might not have that strong of a network in place, or the university systems, for example, that might be starting from a different point, right? That might not have kind of some of that groundwork laid to go ahead and set up an initiative or partnership like this. What would be, I guess, the first step?
Well, we're in a virtual gathering in this global conference. This is a wonderful start to look for partners, for future partners. I think this is, I would say this could be a very good first step. What do you think?
Well, no, I think you're absolutely right. I think the reason why groups and collaboration efforts get started, get together and are successful, I think, has a lot to do with identifying common goals and starting realizing what are the things that we can do to help those get together. And I think universities in particular have this immensely valuable capacity to bring people together through a platform of knowledge. So even a simple webinar in which we say, and we bring people together and we say, look, these are the health implications, these are the policy implications, these are the economic challenges, the social challenges, the ethics of our response. And if we target it to leaders and stakeholders, both in local government and in the business community and civil society organizations, those are very basic steps that will bring people together. And to be quite frank, that's the way in which we were able to come about with this massive effort, by simply answering a couple phone calls and saying, look, this is what we know. We're going to have a short webinar on this. This is what we know. We're going to have a small conference on this. And they were all sort of very immediate responses to demands for projects that have a public impact. I think the critical point as well here is to realize and recognize that universities as institutions which are centrally concerned with the creation and dissemination of knowledge are especially pertinent where this knowledge can make such a big difference in the lives of healthcare providers, of people who are in particularly tough situations in the workforce, and of so many people who are at risk because of this new global challenge that we face. So we just take stock of that and we offer it, and people will find a way to make it work. And of course, I'm sure this can have a lot of different types of variation in communities everywhere.
I just would like to add something else to what Alejandro has just said, that we also need to have a systemic mindset, because this pandemic affects us in many ways. Well, economic, we've seen it, we've talked about it, of course, health issues, but also psychologically, sociologically. I mean, there are many issues at stake, and it affects us all. So having a systemic mindset, I think, would convince possible future partners to set a common ground. That's what I would like to add, Amanda.
Excellent. We have another question from Javier Soto. Dice, ¿qué piensan de la movilidad sostenible como mejor tratamiento social para recomenzar el desarrollo social a partir del COVID?
Wow. Contestamos en español. We in English. What do you recommend?
I think we could. You could respond in Spanish, and then we could also translate as well. Mm-hmm.
Well, okay. Muy importante. La pandemia nos ha ayudado a entender que podemos trabajar de otra manera. Entonces, una movilidad sostenible creo que tiene que estar en la agenda de todas las instituciones. Y creo que tenemos que regresar no a una nueva normalidad, sino a una mejor normalidad. Entonces, ¿qué estamos aprendiendo de esto y de qué manera podemos diseñar otra manera de trabajar y de movernos justamente para pues un planeta sostenible, menos impactado por nuestros movimientos? Alejandro, yo no sé si quieres decir algo más.
Sí. So the question is about sustainable mobility and whether we can think about that as a concept, try to prevent and mitigate the impact of the pandemic and future challenges that we will have. And I think Inés made a very critical point about the fact that this has to be a concept and an idea that permeates our thinking about almost everything that we do these days together. I mean, just to give an example, when we start thinking about reopening, universities and work centers and everything, I mean, just transport becomes perhaps one of the points of highest likely contagion unless certain protocols are implemented effectively. And that's this particular crisis has identified new ways of working, but it has also identified just how there's like a new stratification of society between those who have the kinds of resources that we're using today to communicate and share our ideas, and those who find it a little bit harder for those to be everyday means of work or everyday opportunities for knowledge and growth. And I think that's exactly the point that Inés was trying to drive through, which is that not just a new normal, but a better normal needs to be built, and a better normal, those are Inés's words, must incorporate sustainable mobility, and we need to take stock of the fact of just how costly it is for us to move the way we move, the way we travel back and forth and we commute to work, the way we commute between cities as an everyday or a very significant or permanent challenge for a number of large organizations worldwide, and so on and so forth. And I think it's a crucial question, and we would encourage people to do more research and provide more solutions on that.
Great, and thank you for translating Inés's answer as well. So I think going along with that about these research opportunities for the future, I'm wondering if there have been any key points or key data that we are lacking as we move forward. I think there are a lot of things, but as you've developed this initiative, maybe things that are directly related to this initiative, have there been areas where we just don't have the information that we need to make key decisions? I know there are a lot of things with COVID, obviously, but kind of more about the initiative and these public-private partnerships themselves, where I'm headed.
I think I'll start by saying that one of the things that we have learned is that even if we have relatively robust public health institutions, and even some relatively robust top quality private institutions as well, we have come to realize that there's a premium on the reliability and the speed at which information about these capacities needs to be known and used. So, for example, just the sheer number of beds that were available at the beginning, records were dated, records were not necessarily accurate, but it's not just beds, it's also protective equipment, it's also stocks of protective equipment, it's all, I mean, all of these, we live in a world, and it's paradoxical to a certain extent, where everybody talks about big data and fast data and the ability to use this, but at the very core of our livelihoods, sometimes the systems are not in place, the protocols are not in place, and just the information is not readily used and immediately used. And this is not just happening in Mexico. I mean, I attended a workshop with colleagues at Oxford University, and I mean, a case study that they have has talks a lot about how this was exactly what was happening at top hospitals in London when the pandemic began. So I think the marriage and the adequate use of a lot of these very powerful techniques that we have right now, and in particular, what I would emphasize, public goals, is essential as in terms of taking a step forward. And just, I mean, I mean, of course, there are very significant challenges in communities that are relatively isolated and relatively poor, and that's a massive undertaking to make sure that those have access to the kinds of health facilities that everybody else has. But even in large cities, people have been challenged and have been suffering because they don't know which is the right hospital to go to when there is a crisis in the midst of this pandemic, and lives have been lost. And I think we sometimes take for granted the fact that people need better information, more readily available, and we have not necessarily built the systems for this to be an everyday reality for everyone, in particular for those who are at a more disadvantaged position in society.
Yes, I'd like to add just a couple of points that are a consequence of listening to Alejandro. I think that when this happened, we were not organized at all in the world. So sharing information, expanding it, having it available to everyone is still a challenge today. I mean, even if we've made all the effort, I mean, to share information, we still have to expand it, and education as well. Understanding, for example, now that wearing masks is more important than anything else. So that is a lesson we've learned through this painful experience. And I think one challenge is documenting our experience, documenting it so that a lot of research will go forward, not just for health, the health part of the problem of this problem, but also public policy, communications, education. Now we have a big challenge that is digital online education for all of our children. How are they going to have access to education in this particular moment of this pandemic? So many issues are at stake. Of course, the health issue is very important, but there are many other opportunities.
Thank you. I just wanted to mention that in the chat, there is some information from one of our participants in a website about source and reference information to public on COVID-19 through the website at the University of Medical Services, SBMU. And I thank you for that chat and that information. And we're going to be wrapping up here, but just one last thing I wanted to ask was, going forward with Juntos por la Salud, how do you see the next steps of, for example, private sector engagement to help with the sustainability of the effort, and those kinds of investments maybe in some of these areas where we've determined there are these gaps, for example, with access to digital education and those kinds of things. We just have a few minutes, but I wonder if you could touch on that briefly.
I would say two things. One, of course, is philanthropic efforts that are ongoing for issues of this sort, not just on behalf of private universities, but nationwide specific efforts to try to address these challenges. But also, in particular, I think from the university's perspective, research, applied research and basic research that both identify not just the problems, but in particular methods and practices and entrepreneurial efforts, public entrepreneurial efforts in which we bring together capacities, just like we did in Juntos por la Salud, to try to bridge these gaps as quickly as possible. This is a critical point. When we think about the need of public transformation, we need to take stock of the fact that there is a massive number of challenges that are accelerating rapidly. The pandemic is just one example of them, as hard as it has been. It's not the only one. Sustainability from the climate perspective is obviously another one, but every single one of them, the future of work and the impact of automatization and the inequalities, even if they're short-term inequalities that this phenomena are raising, we need to have better ways of addressing them. And in particular, we need to harness technology and data science to make sure that those actually serve definite public goals and definite public services. And I think we need to use our capacities as universities to use research and knowledge-based solutions to address those.
Yes, I think that we need to understand that this is an inflection point, and we have to, to move forward and to think that this is an opportunity, to maybe overcome some gaps that have been really widening in the past decades. So, as Alejandro said, it's not just a pandemic. I think many things have to be fixed, and this is an inflection point. The pandemic has just showed us that we're going through a very, very rapid transformation. And, we have to understand it. The first thing is to be conscious of it and see what we can do. Next steps. Mm-hmm. Thank you, Amanda.
All right, thank you to our panelists so much for telling us about this initiative based on collaboration, public goals, and looking forward to what we can do. And I thank you to all of our attendees for your time, and also for the UGC to sponsor this event. So if you have any other questions, you can let us know, but also the recording will be passed along with the materials from the conference. Right. Thank you very much.
Great, thank you.
Thank you. Thank you.
Thank you.
Take care, bye-bye.
Bye.